In today's video, I want to demonstrate the home exercise program I give to my patients with knee arthritis. Hi, Dr. Brian McGee, physical therapist with Rexercise. I see tons of patients in my physical therapy clinic with knee arthritis. And what I more specifically mean is osteoarthritis, or that form of arthritis that's associated with wear and tear. And what's really wearing down is the cartilage between the bones, usually from our use pattern over time, possibly injury history, genetics. Whatever the cause, this cartilage just wears down over time. And if it wears down enough, we get pain, we get limited muscle strength, limited function. And when these patients come to therapy, they always ask the same question. What's the point of therapy? Why don't I just move on to a knee replacement? What they don't realize is that physical therapy is really effective at decreasing pain associated with arthritis. And not only decreasing pain, but improving muscle strength, range of motion, and therefore function. And when we can accomplish these things, we can often delay surgery substantially. I mentioned that physical therapy can decrease pain associated with knee osteoarthritis. When I say that to my patients, that they generally get a little bit of a laugh because often they come to physical therapy expecting pain. PT is often not associated with decreasing pain, but in this case, it's really true. And in fact, when physical therapy is compared to anti-inflammatory medication and even opioid pain medication, it comes out on top at decreasing knee pain associated with arthritis. It's the most effective intervention for this purpose. And that's huge because if we can delay surgery, it can be super helpful. I've got a few patients now who have kind of bad knee osteoarthritis, but for a variety of reasons, don't want to have a knee replacement in the immediate future. So for example, one person just got a new job, they're in their probationary period, they can't take a lot of time off to recover. Another person is still working and is looking at retiring in a year or two, and then they want to possibly move forward with their surgery. And yet a third is really too young. She's in her later 40s, really too young to be a great candidate for a knee replacement. So bottom line with all of these patients, our job in physical therapy is to help buy them some time. And therapy is very effective at doing that. So what does the program involve? Primarily three things. Foremost, strengthening. Thigh muscles, hip muscles, core muscles. The stronger we can make these muscles, the more they can absorb the shock of movement, of weight bearing. The more the muscles absorb shock, the less the joint surfaces that are damaged have to. Number two, range of motion. As you might imagine, folks with knee arthritis often have a stiff knee. The more we can improve range of motion, the more the stress of movement is spread over a greater surface area and therefore not concentrated on the injured spots. And number three, hands-on work. There's just no substitute for actually seeing a therapist, at least to start. Oftentimes what I find with my patients is it's not just the knee that's stiff, their ankle and hip may be stiff as well. And we'll do various hands-on techniques, exercises in the clinic to address that. And the exercises I'll demonstrate are the exercises I give them to take home. Our first exercise is a banded squat. So we have a band around the knees, pretty tight. Knees and feet are about shoulder width. The point of the band is it's pulling my knees inward, and I'm having to fight that. I'm pushing out a little bit into this band, trying to keep my knees about lined up with my toes. And I'm simply going to squat down to this bench. Helps to have something behind you, a chair, in this case a bench. Either way, squat all the way to the chair or bench, up and down, again keeping the knees and feet about aligned. Now if you can't quite make this depth, either because the knee is stiff or sore, fine, just cut it a little bit short, and over time try to gradually improve the squat depth. If you can do 3 sets of about 10 to 15 of these, you're doing really good. Our next exercise is banded, got a band again, hip abduction, or lifting the hip to the outside. So in this case, we'll pretend that my right side's the hurt side. You'll want something for balance. I'm using my bat. You can use a broom handle. You can use a piece of furniture, a wall. Have some balance assist. Now, try to stay upright in the torso and simply lift the hurt side back and out, kind of at an angle. Okay, so it's the legs going back and to my right, trying to stay upright in the torso. Do about 10 to 15 repetitions. Okay, now with this one, it's a little funny because you'll want to do both sides because the stance leg is working about as hard as the moving leg. And so again, about 2 to 3 sets of 10 to 15 repetitions. The next exercise is a banded bridge. We're getting a lot of use out of our bands. So again, a band around the knees and feet about shoulder width, so there's some tension in that band. And again, the point of the band is it's pulling my knees inward. My outside hip muscles are having to fight that a bit by applying outward pressure into that band. Pushing through my heels, I'm simply going to lift my butt up off the floor, hold for a couple seconds, come down kind of slow. Up, hold for a couple seconds, come down kind of slow. 10 to 15 repetitions, 2 to 3 sets. I mentioned core muscle strength. This next exercise is really our chief core muscle strengthening exercise. And before I demonstrate that, I want to remind everybody, if you find this content helpful, click those like buttons, subscribe, leave a comment, let me know how you're doing with your knee arthritis recovery. But anyway, back to core strength. One of the best exercises for improving core strength is the side plank. So on one forearm, on the knees are bent about 90 degrees. You're kind of straight between the spine and hips. You're not curled up in a fetal position. Okay, you're kind of straight here. Lift the pelvis up, hold for 10, 20, if you're strong, maybe 30 seconds, and relax. So do about 2 or 3 per side. You got to do both sides. Now, if this is easy for you with the bent knees, you can get ambitious and straighten the knees and do a full side plank. In the intro, I mentioned range of motion. As you might imagine, folks with knee arthritis usually have a stiff knee. We'd like to get back as much of that movement as we can. So this exercise is for improving knee bending. Very simple. Simply lay back. In this case, it's my left knee that's the hurt knee. I simply grab below the knee, grab the shin, and pull with kind of gentle to moderate force up toward the chest. You should feel a sense of tension, a sense of stretch or tightness. You shouldn't feel sharp pain. Remember, the point of the program is to decrease pain, so there's no need to pull super hard here. So about a 10 to maybe 20 second count, 3 to 5 repetitions. Our last exercise is for knee straightening. As I mentioned in the last exercise, usually folks with knee arthritis have a stiff knee, and they're really stiff often with straightening, with extension. If we can get even a little bit of that back, it really makes a difference in their pain and their function. So here's a great exercise for that. Prop the heel up on something, a chair, the ottoman, the coffee table, so there's nothing under the knee. Clench the thigh muscle. This will push the knee down toward the floor. Might not feel great. You'll feel some tension, some stretch. Again, it shouldn't be sharply painful. Hold for a 10-second count. Relax the muscle. Take the tension away. Repeat. Clench, pushing the knee down, 10-second count. Relax. Do 10 of these. Clench, push down, 10-second count. That's my knee arthritis home exercise program. This is what I give my patients to do at home who I'm working with in the clinic. I hope you found this video helpful. I hope it helps you get back to what you love to do. Like, subscribe, leave a comment. Let me know how you're doing with your knee arthritis recovery, and we'll see you in the next video.